So I'm starting getting knowledge from different websites, books, talking with people, going to meetings, conferences, and all these resources that I was accumulating from that I started my PhD in 2016 until last year. Say, okay, now I think that I have a good background. I have a lot of information that I could share probably because I think that most people are asking the same question that I asked myself some years ago. And if I can help with them, why not?
Welcome to the People of Pathology podcast. I'm Dennis Strank. On this podcast, we explore pathology, one story at a time, and connect with the people behind the diagnosis. For today's guest, pathology is more than a diagnosis. It also includes the system that makes that diagnosis possible. Dr. Luis Cano is a pathologist working at the intersection of clinical medicine and artificial intelligence. Through his Substack, Beyond the Slide, he's exploring the technology behind pathology and where it might lead us. We'll talk about the evolving role of AI in pathology and how technology just might change the way we think about our work. All right, let's get into this conversation with Dr. Luis Cano. Thanks for being here with me today.
Well, thanks, Dennis, for having me here. It's a pleasure for me to share a moment.
Yeah, this will be an interesting conversation. So the place I'd like to start with you is your career path, because this has taken you through several different countries, and this path seems to have kind of two branches to it. So there's the pathology part, which we'll talk about first, and then there's a computer science part, which I want to get into after that. So let's start with the pathology part. Can you tell me, what was your inspiration to choose this field?
Yeah, for sure. Well, how I can say, I went to medicine because I've been in the both sides, in the part of the patient and also in the part of the physician. When I was young, I was diagnosticated type of tumor that I have in my right clavicle. So at that moment, I got 8 years, if I well remember. So my mother took me in Peru, the healthcare structure is different. It's not as in the first world country. It's principally all is centralized. And the biggest hospital to treat this type of diseases is in Lima. I live in Chimbote. So my mother took me from Chimbote to Lima. And I did all the treatment and all the following process there. This tumor was at the end, if I will remember, was benign. So was not a problem. But in 8 years, child, it's a little bit complicated for the parents to assimilate. So
right
at that point, I sensed that in the part of the patient, you can experiment and you can feel different things. At the moment that I need to decide about which type of or which study I want to follow, I decided medicine because I was already in the field of the patient, feeling all those problems, experiment all these, how I can say, different timelines or different situations for in the way of the patient with this type of diseases. So I decided to become a physician. And to get in the point of your question about pathology was principally because I was asking to myself which specialty or which fellowship could help me to better understand what is happening behind the tissue or what is happening in real in the disease. I experiment for surgery, but I'm not so, how I can say that, my hands are not so specialized to do what the surgeons do.
Yeah.
Clinician, but it's not the best fit for me. So I decided pathology. In pathology, we spend a lot of time reading, thinking, analyzing, and I think that fits better with I am, the way that I act.
Okay. It fit more of your, I guess, personality, right?
Yeah, exactly.
Okay. I can actually relate to that pretty well. All right. So let's talk about the other part of it then, the computer science part. You've written about, you were interested in computers from a pretty young age. Can you tell me that story and how did that interest develop?
Yeah, for sure. When I remember, my interest in computers started with my father. My father worked in a company, a very important company in Peru. So his company was one of the first companies that brought IBM computer to Peru. The biggest computer in the size of a wardrobe, something like that.
Yeah.
I remember when I was a child, my father took me with him to his work, his job, I saw the computer. At that point, I said, wow, I had 6, 7 years old. So I see how this computer start processing all this data, the printing papers and so on and so on. The floppy disk at the moment, the biggest one, not a 3.5 inch. So for me, that was amazing. According to after, I remember I got a computer when I was in the university. So several years later, because the situation in my country was a little difficult. So at that point, how I can say, all those feelings that I already experienced when I was a child become again, or started again. At that point, I say, why not? And I started exploring by myself. At that point, and when I started, we were 2004. The internet was already deployed, so we started using internet. I started asking questions, how I can build something. I started working with programming. I started learning a little bit of code and so on, but always focusing medicine. And at some point in my career, in the development of my career, during my studies, I say, if I put these two things together, what will be the result? So at that moment, I'm talking to 2006 or 7 maybe. I'm starting speaking about, okay, I would like to use a computer as a physician. Most people say, no, you're a physician. Physician is just physician and not computer, so go away, something like that. So I continue developing this idea. That idea keep in my mind, and I continue asking and seeing how I can merge these two specialties together. And I discovered that when I started my PhD in Rennes, in France, in 2016, because we can use computers and the part of programming to do a lot of things in medicine, to standardize a lot of things in medicine. At that point, I discovered R, the programming language. Sorry for the statistician, they're going to say me that it's not a programming language, but well, I'm doing my best. And I started using R and started to go deep in the statics, the part of machine learning, the part of neural networks, and say that should be used in medicine because that helps us to explore in deep what the tissue is already telling us. Because as a pathologist, we have some limitations at the moment to interpret the tissue. We are seeing patterns, but we are not able to quantify in a precise way how this pattern is explaining why this pattern is telling to us. So in that sense, I decided, I see, computer here, it's a valuable asset. We need to use it. And I discovered that a lot of people like me are thinking in the same way, and the computer scientists, the bioinformatician, they are also working in that sense. So that was my opportunity, and that was why when I was a child, started interesting in computers.
Mm-hmm. Okay. It's funny, the more people that I talk to about this topic, it seems like having at least a basic understanding of informatics in pathology is it's getting to be more necessary. Do you know what I mean?
Yeah, totally agree with you. I think that will be a priority now to the universities because as a physician, I'm trained to make the diagnosis, to see the tissue, but I can't be a part of what is happening in computer now. Computer is almost everything. It's almost everywhere.
Yeah.
You can use ChatGPT in your phone. You have a very strong computer in your hand, your phone, and you need to be able to know about these tools and how to use or how to incorporate these tools to your normal workflow, your normal job, work. Mm-hmm. So I see that now it's necessary, and universities should be, and also not just university, people, young physicians should be more interested in how the computer is impacting in their works and what will be the future in medicine and also in computer.
Mm-hmm. Okay, that makes sense to me. Now, you're talking about how you had interest in computer science and how computers work, but now, and I think you just kind of mentioned this, AI is becoming more of the focus, and especially in pathology, right? There's kind of this intersection that you've talked about in other places, this intersection of clinical medicine and artificial intelligence. And I wonder, like, at what point did you realize that this also applied to pathology and this was something you could pursue?
I think we have, how I can say, the interaction between pathology and artificial intelligence is vast. We are just seeing the point of the iceberg. I think that it's the best metaphor.
Yeah.
because we are just starting to understand how measuring the tissue in a reproducible way. But we need to understand in deep. We need to understand what the pattern is saying, how the pattern interacts, how the cells are interacting between them. That question could be addressed, could be resolved with the use of computer. And also, if we are considering the pathology in all the how I can say, in the broadest specialty or in the discipline, we need to consider, for example, single-cell transcriptomic, spatial pathology, spatial transcriptomic, and add all these layers, not just hematoxylin and neosin. We can use it also immunohistochemistry. We can use it histochemistry. We can use it immunofluorescence. So we have different layers and layers for complexity. What we are doing now is just see, I will say, the 10% of all the things that we can do or we can achieve if we are merging pathology with the part of digital.
Okay. You wrote an ebook, and I want to talk about this. It's called Getting Started with Digital Pathology. When you were beginning working on this, did you have a target audience in mind?
To be honest, I started my book after to read another book of Austin Kleon, if I will remember, was one book of Austin Kleon is Still Like an Artist. It's very interesting. I recommend to everyone.
Oh, I've heard of that.
It's the best one.
Mm-hmm.
And one of the quotes that Austin Kleon say in one of their podcasts is, write the book that you like to read.
Okay.
So when I started my journey in digital pathology, I was totally confused because I don't know which, how I can say, I don't know, or I do know the starting point.
Uh-huh.
Was very confusing. At the beginning, I am pathologist, so now I am pathologist that I'm working with R, I'm pathologist that I experiment with Python. There is something that merged these both in the same place? No. So I'm starting getting knowledge from different websites, books, talking with people, going to meetings, conferences. And all these sources that I was accumulating from I started my PhD in 2016 until last year, say, okay, now I think that I have a good background. I have a lot of information that I could share probably, because I think that most people are asking the same question that I asked myself some years ago. And if I can help with them, why not? So that is why I decided. My book is principally addressed for all people, independently if you're a pathologist, if you are a data scientist or not, that want to go deep in this new discipline that we are creating now.
About how long do you think did it take for you to write the book?
That's taken me at least 2 years, 1 year and a half, I will say.
Okay.
Because I developed it when I was doing my pathology training fellowship, the habit to write. So I started writing in my own books after blogs. So I developed this attitude to write and write. So that was the easy part, was right. The complicated part was organize all the knowledge that I already accumulated. But at the end, I think that at least I am happy with the result that I produce. I read at least 3 times and I feel that, wow, I can't believe it that I did that. But was my achievement for the moment.
Yeah, it's good. I like it. And I'll include a link in the show notes for this episode that people can pick it up. The book explains like the foundational concepts and the technology in digital pathology. And then you provide some examples from specific software options. One theme in this that I want to highlight, you encourage the reader to try things for themselves, to ask questions for themselves, and also to connect with other people in the digital pathology field. I'm wondering, did you base any of these off of experiences in your own career that you did these things and then you wanted to share that with other people?
Yeah, totally. And I would like to share this history with you because I remember when I was doing my fellowship, my pathology fellowship, I scribed for a congress about prostate cancer. I was talking in 2014.
Okay.
Yeah, 2014 in Lima. So this international conference was an update in prostate cancer from a pathologist perspective. Something like that was the name of the congress. So in that congress arrived 2 pathologists from US, one of the NIH. And that pathologist started seeing, explaining, and so on and so on. So I say, at that point, I was looking for the opportunity to improve myself, because one of the paths that I took inside of pathology was liver pathology and genitourinary pathology. So I was a very fan of prostate and kidney pathology at that point. So at that moment, that pathologist that finished his lecture, he was in the room speaking. At that moment, I say, why not? If I ask him to get a training stage or a stage in his hospital, why not? What can I lose? What can I win?
Okay.
In the best scenario, I can win my stage of 3 months. In the worst scenario, they're going to say, no, sorry, bye. That's it. At the end, I won the part of 3-month stage at NIH. That was, how I can say, one of the biggest experiences in my life, because at that point, I feel that I am doing something. I saw for first hand how the technology is moving around medicine, how the science is developing. Was, how I can say, a revelation moment for me.
Yeah.
So that is why I learned a lot about this experience, because it's trial and error. Just try. Connect dots and try. Ask for a question. People could say, oh, myself, sometimes I was thinking, maybe my question is very stupid, or maybe my question is not so adapted to that audience, but try.
Right.
Just try. In the worst scenario, someone gonna say, oh, please shut up. And that's it. But in the best scenario, that could be open a lot of possibilities. And that's what exactly happened to me. So that is why I'm saying, please make mistakes. Please just interact. Please give an advice, or request for advice, or try. And never stop to trying, because in one of these tries, you're going to get something.
Yeah. I love this perspective, because I feel like that's how the greatest advancements come, because people try something that maybe is a little unorthodox, a little unusual, but that's where the breakthrough comes from, right?
Totally. And I think that at the end, if you try, you are winning 2 times, because you can win, as me, for example, the possibility to get an stage in US, or if not, at least you are learning from what mistake teach you. Because what was not good, because the presentation was not good, because the people was not the best fit for you, the offer was not clear. So you are constantly improving.
Yeah.
It's not just I lost. No, you are already winning something.
I like that. That's great advice. More recently, you started a Substack called Beyond the Slide. I want to talk about this for a while. First of all, what was the inspiration for starting this?
Well, as I mentioned, I developed the habit to write. So I remember, I think most part of my life is based on history that you want to share. I have another one for it.
Okay.
When I was doing my pathology training, I started with my own Google blog in the platform called Blogger, something like that. Now I think that the platform is already dead, but at that point that was working. So I start working my blog called Suprahumanos. It's like superhumans. It's about personal development and how could be improve yourself during the part of the how I can say the training as a physician. How you can share some knowledge that could be useful for other ones. So I developed this attitude, but unfortunately, for time, my blog finished, or I must cancel my blog because I don't have time to continue writing. But I developed this attitude. When I was working here in France, I started reading, but by myself in a Word document, reflection, some ideas, how this could be done, what I could be better, how we can improve that. So one day I decided, okay, I have a lot of material that I already wrote, why I can start sharing. And in that sense, I started my Substack, and I started obviously working more, adding reference to all the thoughts that I already have. And I decided to share what my original idea was, if that could be useful for someone, great. But fortunately, I saw that a lot of people was interested in what I wrote, and I decided to move it forward. Now I publish an
Yeah.
article by week. I have a good of acceptance from part of the public, and I got a lot of feedback, a lot of friends, a lot of new ideas. Someone is telling me, "Okay, I saw the same problem, but thanks for address it." Or your post is very insightful. Thanks for helping us. And I'm constantly connecting with other ones that could be help me to improve and help to improve the discipline of digital pathology.
You're listening to the People of Pathology podcast with our guest, Dr. Luis Cano. We'll be right back. When it comes to cancer staging, one of the most important parts is finding all of the lymph nodes. I should know, it's what I do every day. Yet this process has remained the same for over 100 years, manual, tedious, and time-consuming. That's a problem, because every missed lymph node can mean inaccurate cancer staging. That's about to change. Enter InVision from Cision Vision, a first-of-its-kind device that's redefining the standard of care. Traditionally, we identify lymph nodes by sight and feel alone. InVision changes that using short-wave infrared technology to make lymph nodes stand out clearly from surrounding fat and in real time. In its first 104-patient study published in the Journal of Clinical Pathology, InVision helped increase lymph node counts in 86% of cases and even upstaged 4% of patients from N0 to N1. I personally contributed to this study, and let me tell you, seeing the technology's impact firsthand was amazing. It's time to invest in grossing innovations that improve patient care. So, how is your lab approaching innovation in grossing? Book a demo at demo.cisionvision.com and start seeing lymph nodes like never before. Are you thinking about applying to a pathologist assistance program and feeling a little lost? That's why I created the Path to PathA, your PA school application blueprint. This is a step-by-step prep course that gives you everything you need for a strong application. From finding shadowing to writing a standout personal statement to prepping for interviews, this course was made to help you feel informed, confident, and ready. Visit www.thepathtopatha.com to join the mailing list. You'll be the first to hear when the course launches. Your path starts here. Now for the rest of my conversation with Dr. Luis Cano on the People of Pathology podcast. You did a 3-part series on integrating AI into the pathology workflow, which was really interesting. I really enjoyed that series. And part of it was because you make this distinction of using AI because we can, as opposed to using AI because it improves decisions, reduces risks, and safeguards the patient journey. Can we talk about this?
Yeah, for sure. At the moment that ChatGPT arrived, everyone started saying anything and nothing about ChatGPT.
Yeah.
Coders or developers start creating code. Patients start asking for their diseases and so on and so on and so on.
Yeah.
So I think in that sense, I think that me as a physician, and this is just my opinion, we need to be, how I can say, we need to be sure of what we are doing with that and how we're going to use it. Because anyone could say anything to ChatGPT, and ChatGPT will say always an answer, independently if it's wrong or not. And that could work for people that want to just spend some time doing nothing, everything in ChatGPT.
Mm-hmm.
But we as a physician, we have a responsibility behind it. In that sense is how I see the things. Because if, for example, if I put in ChatGPT the symptom of my patient and ChatGPT give me the answer, an answer that I'm not expecting, I need to be aware that what ChatGPT is saying me, it's according with my reasoning. If it's not against, and it's helping me to improve my reasoning or going further of them. Because if not, that could be dangerous.
Yeah.
At the end, the decision to take or not what the ChatGPT is saying or what AI is saying or telling me depends from me, because I am in front of the patient. So in that sense, I need to be cautious about what I'm going to do, how I'm going to do, And if all the things of all the information that I am able to get from AI, it's according to what I'm thinking or what I'm considering as part of my clinical reasoning. So in that sense, I think it's not just use the tools or the AI tools. We need to be informed. We need to be conscious about what we go in which type of cases we want to use. That is why in one of the recent post that I wrote in my Substack, I talking about the framework human in the loop.
Yes. Mm-hmm.
The human in the loop is good because at the point of the human point in as a control measure for this automatization of AI. But at the end, we are really adding something, or we are just overloaded with different type of knowledge and reasoning, because AI is just presenting information. It's not saying that is good, that is not good, or that is the level of evidence 1, 2, or 3. No, this is just presenting information. All the information that is presented from AI is right in the same level of confidence. So I think that we need to use the AI in a way to extend our knowledge. For example, I have a patient in front of me. I have a possible diagnosis. I have 5 possible diagnoses according to the level of how can I say, prioritization.
Okay.
One diagnosis for me could be the most probably. The other 4 is no probably. But I need, in that sense, use the AI, for example, to give me these 3 or 4 diagnoses more that could be unimaginable, but should be considered because could be matched with a rare disease. Obviously, I don't use this diagnosis as my first choice, but I need that these possibilities are there. So if my patient is not responding to the first diagnosis or to the treatment, why I can't consider that? In that sense, it's informed. In that sense, I am taking the risk. In that sense, I am organizing and orchestrating all the information according to what I'm seeing. Because at the end, the AI is just learning from a context. But the patient is not just a context. The patient is an ensemble of a lot of things. How the patient feels, how the environment, how the patient interact with the other, the comorbidities, and so on and so on and so on. So that is the point that you are touching. It's not because we can use, it's because we need to use it in a right way according what we are looking for.
Mm-hmm. Okay. So it has to have a purpose. It has to make the patient care better.
Exactly.
Right. Right. And I like that distinction. And so I'm glad we talked about that. Something else you've written about is how AI can assist pathologists in targeted therapy, because the role of the pathologist in targeted therapies is expanding. What kind of things are you talking about there?
I think, for example, I'm going to give you what I lived when I was working at a hospital in Peru.
Okay.
The moment that we got the specimen, that's mean the tissue coming from surgical room, we start the process of transforming this specimen to slides. And after that, I got the slide, I give my diagnosis. I wrote my diagnosis according to CAP protocols. And then if the diagnosis needed, or if the protocols needed, I run some immunohistochemistry test. Or always I can use immunohistochemistry to clarify my diagnosis. So at that point, I finish the diagnosis, I sign the diagnosis, and diagnosis goes to the oncology, and that continue in the way to treat the patient. That means the oncology is going to take a decision, going to read my diagnosis, take a decision from that, and so on and so on and so on.
Yeah.
So that is the way that I lived pathology when I was working in my hospital. But I think now pathology will be not the person that is just filling the form of giving the diagnosis. With AI, we have the possibility to give more, because we can start analyzing patterns and say, okay, according what the literature is saying, this pattern that is already analyzed with AI should be, or it's indicative that the response to treatment. Or in that sense, I see this, for example, TLS inside of the tissue that they are analyzed with AI, and the correspondence with these immune cells of the tissue, it's according to this score. And that allows me to say this patient will be, the response to treatment for this patient will be not the best that you are considering. So please take care of this patient. Oh, change the follow-up, not for 6 months, for 3 months, because we need to be careful with him. I think now with the use of AI, we are getting the possibility to extract more knowledge from the data, from the images. And with that, we're going to be able to create different hypotheses to follow from close to the patient in that sense, because at the end, we are working for them. We are using all the things that we know and all the things that we can interpret to give the better for our patients. So I think that is a possibility that AI is open for us. And I think that the role of the pathologist will be not from the people that is just writing or just filling the diagnosis and describing if there is vascular invasion, perinephral invasion. No. Now we're going to be the part of the orchestra that will leading how the diagnosis, how the interaction will be, and how we can be more close to our patients than ever.
Okay, I like this a lot. This is kind of a subfield, I guess, of pathology that really shows a lot of promise. I mean, we don't know at this point how much data is there in that pathology image. And, AI is helping us discover these things, but there could be more than we ever imagined, I think.
Totally. I think, as I mentioned, we are just seeing the point of the iceberg because
Yeah.
we have a lot of things to understand. I remember when at the first time that I saw the pathology slide, I have a lot of millions of questions. Why the cells are distributed in that way? What that distribution means what? How I can understand better? Why these cells are more clear than the other ones? So all these hypotheses that I think that they are living in all the minds of pathologists, now we can, using the AI, we are able to get the answer for all these hypotheses that we already have.
Mm-hmm. Yeah. And that's exciting.
Yeah, totally.
Yeah. Okay. So recently you wrote on LinkedIn, and this is actually how I got in contact with you. So you wrote about the potential for digital pathology in histotechnology workflows. Now, I'm a pathologist assistant. I used to be a histotechnologist. So this was really, really interesting to me. Can you talk about some opportunities to automate and improve the histotechnology process?
Yeah, for sure. I think that one of the beliefs that we had was that digital pathology started at the moment that we have the slide, and that's it.
Yeah.
We start digitalizing the slide and using a lot of AI over the images to get better insights. Okay, that is totally perfect. I'm totally agree with that. However, we forgot the other part because this slide don't arrive to our hand as a slide, arrive as a tissue.
Yep.
And I remember when I was doing my fellowship that technicians in a hospital told me that the 50% of your diagnosis comes from macroscopy, not just from the slide. And that is totally true because in macroscopy, you can see the extension of the tumor, if the margins are compromised or not, obviously the macro compromise. You can see the color of the tumor, the percentage of necrosis, and you can decide which part of the tumor you are taking. Because in the tumor of 10 centimeters, it's not possible to take all the tumor inside of the slides.
Yeah.
So all this part also could be improved with AI. And that is one of the weak points in pathology now, because we decide and we are considering, or we are doing the macroscopy according to the guidelines, according to some protocols, but not all protocols are standard. So we have the opportunity to see the images. We have the opportunity to create 3D reconstruction. We have the opportunity to see we are using this tissue, this tumor in that sense. We are cutting these areas. We are processing in that way. We are improving our times, the fixation time, the hematoxylin eosin staining time. With that, we are start building the system. Because at the end, digital pathology is not just digitalize the images. No, it's part of the system. And now we need to build this system in a good way, because if we want to scale up, that's mean getting all this information, merge that with clinical records or radiology images, we need to build a good system working in all sense. That is why, for example, the part of the macroscopy is important. And I was talking with a company some days ago that they are specializing in that part. They are creating workflows to improve how the tissue arrive considering the times of cold ischemy and warm ischemy, to improve, to say, okay, according this specimen spend, for example, 45 minutes in surgical room. So for this, the algorithm is saying me that the time of fixation should be, for example, 2 hours or 3 hours. So
Right.
now we are adapting the standard methodology for each case. And with that, we are trying to maximize the quantity of information that we can extract. And also we adding, with all this improvement, we are adding the layer of traceability.
Okay. Right.
And with that, we can able to say, okay, this slide comes from this specimen for in that part, in that area. With that, we are sure 100%, well, at least we're trying to do the best we can to sure a good traceability and to get the most quantity of information that allow to us to get better diagnosis.
Okay. I love this for a few reasons. One is this is going to affect my job. And I think it's exciting when new technologies come into that area. You know, you were talking about earlier how using AI to analyze the microscopic image. Do you think, and maybe this is in the future yet, but the macroscopic, like if you take a photo of a specimen, do you think there are some opportunities for AI to extract data from that?
I'm totally convincing of that because, for example, when I was doing my fellowship, I'm full of history.
Okay. No, that's good. I love these stories.
When I was doing my fellowship, I remember I was obsessive with kidney tumors because I did my fellowship in the National Cancer Institute in Peru.
Okay.
So I was obsessive with kidney tumors. And in kidney tumors, I think that the location of the tumor is important and also the extension of the tumor. So that's need to be documented, for example. And the tumor is very heterogeneous. So at the end, you start slicing the tumor in different slides. And you need to measure, you need to see the percentage of necrosis. You need to see if the tumor compromises some important structure or not, for example, veins, arteries or veins, the capsule of the kidney capsule, yes or not.
Oh, yeah.
So I think if we using the AI to create reconstructions, to create 3D models, to see the macro architecture of the tumor, and that we are able to link to the microarchitecture that is the histological slide, we have the full perspective of what the tumor is doing. And in a future, that will be not just necessary to use the slide. We can make possibly, the diagnosis from the structure of the tumor.
Yeah.
You see, at the end, we're going to start connecting dots to tell all the story, not the microstructure story, also the macrostructure story.
Mhm.
And that will be important. That will be totally phenomenal for me.
Yeah. I love this. This is great. I want to end with this last question. So if we imagine the pathology lab of, say, 5 to 10 years in the future, and so this is a lab that incorporates digital pathology and AI, what do you think that lab is going to look like? And how will that future improve patient care?
Wow, that is a good question. And I have some dreams about it because as you imagine in future, well, the microscope, I'm how I can say that I am one of the biggest defender of the microscope. I would like to have my microscope always to me because it's part of my identity.
Okay.
But I see that microscope also could evolve. And one of the companies that was working now, they are creating this type of microscope that is connected to physician for a visors, like a Google, like a Oculus Rift of Facebook. I think.
Yeah. Okay.
It's very impressive, to be honest. I would like to have one of them. I think that will be the evolution. At the end, we are not just seeing microscope. We are not just exploring these images. We are using different human or physician device interface to help us to see the tissue, to extend the tissue, to measure, to touch the tissue in real time. Something like it's like using the Apple, the Apple Glass, Apple Vision.
Oh, yeah, right.
Something like that to see, to explore the tissue, to change the position, to see the 3D of the tissue, and from that start extracting all the information that we got. For example, blood vessel distribution, for example, mitotic cone, for example, spatial location of TLS, infiltration margin from the tumor. And with that, we're going to be able to say, okay, according to the publication, this infiltration, we are seeing the 360 degrees, how the tumor is infiltrating. So we can see the prognosis of this patient will be better in comparison to the other one. We are seeing a lot of TLS around the tumor. So this patient will respond better to immunotherapy. I think that now we are just seeing what we're going to be able to do in the next 20 or 50 years. We are just seeing a small part.
Right.
And we have the opportunity and also the duty to improve that. And always in the service of the patient, because at the end, we are working for them. We are doing our best for them. And we want that all the efforts that we are doing today using any type of technology will improve the life for patients in the next future. So I think labs will evolve. A lot of technology will see the right and left, but always keeping in our mind is for our patients, and always also keeping that AI is here as a tool. It's not for replace us. It's not for change how we're doing medicine. No, it's a tool to improve our human side of medicine, because we need to be more human than ever now that AI is here.
Okay. That's great. I love that. I think that's a good place to stop. Dr. Cano, this has been a very interesting conversation. I appreciate your time, and I really appreciate your stories. They've been very interesting. So, Dr. Luis Cano, thank you so much.
Thank you so much, Dennis, for having me. It was a pleasure for me too.
If you're looking for another episode of the People of Pathology podcast to check out after this one, here's a clip from my interview with Dr. Richard Levinson, as we talk about how AI is useful, but it's only as good as the data on which it is trained.
And then, of course, even if all of your data is perfectly calibrated and accurate, then you need to make sure that the data you choose to put in your model actually reflects the population that you might apply it to. And, very often you might have something that's developed at Harvard or Johns Hopkins filled with, sort of wealthy white people who are getting top-of-the-line therapy. And then you develop a model, and then you try to apply it in Haiti or somewhere else where the population is completely different, both in terms of exposures and in terms of when they present. Is that disease early or late? And so the answers actually will be wrong, just plain wrong, because they didn't match the input data with the population they're looking at. And that's another huge problem. And, I could go on, but that's sort of part of the story.
You can hear more from Dr. Richard Levinson in episode 159. All right, big thanks to Dr. Luis Cano. One of the things that I really enjoyed about this conversation was how Dr. Cano is exploring the future of pathology. He's also thinking deeply about how we talk about all these changes and how we make sense of them. And that really comes through in his Substack, Beyond the Slide. What I really like about Beyond the Slide is that it slows the conversation down. There's a lot of noise about AI right now. There's big claims, bold predictions, and a lot of focus on what these AI models could do. But his writing consistently brings it back to reality. What actually matters in a clinical environment? What actually works? And maybe most importantly, what problems are we really trying to solve? And you heard that in this conversation. The idea that the biggest opportunity for AI might not be the diagnosis itself, but everything around it, the infrastructure, the workflow, that invisible layer of pathology. That's exactly the kind of perspective he explores in his writing. Dr. Cano also spends a lot of time talking about impact, not theoretical impact, but measurable impact. In environments where time, staffing, and resources are limited, AI has to justify itself. It has to reduce errors, it has to improve turnaround times, support decision-making, or expand access. If it doesn't actually improve things, then what's the point? And I think that's an important lens for all of us, especially as more tools are emerging. Another theme from his Substack and from this conversation is the idea of trying things and asking questions. Dr. Cano writes about this in his ebook, Getting Started with Digital Pathology. It's one thing to learn about a concept, but when you actually apply it, that's where you actually learn how it works. And then you come up with your own questions. And that leads to the bigger questions that Dr. Cano is exploring. Because technology is only the foundation. What we build on top of it, that's where the real impact happens. As always, I'll have links in the show notes to everything that we talked about today. Don't forget you can follow the show at People of Path on Instagram, or you can just connect with me on LinkedIn. Thank you for continuing to share the show with others. Together, let's inspire the next generation of pathologists and laboratory professionals. This show is a member of Health Podcast Network. Thanks for listening. I'm Dennis Strank, and I'll talk to you next time on the People of Pathology podcast.